and welcome to the podcast of Loughborough University's Institute of Advanced Studies, a podcast where our international fellows discuss the most pressing issues of today that we're all facing and share their exciting research ideas. We hope you enjoyed today's talk. Thank you for tuning in.
Thank you everyone for joining us today. We just thought this was a lovely opportunity. We have some visitors joining us from the University of New South Wales and from Way UK, based down in Swindon. I'm sure they'll tell you about themselves a little bit more in due course, but they've joined us today. We've been having conversations about shared areas of interest around the sport for development space, and we thought it'd be a great opportunity for them to also share more broadly. Because there are lots of areas of interest that might connect in with other folks' work. So without further ado, really, I will pass over to you, Sally, to start with, and then perhaps others within the team can introduce themselves in due course.
Thanks so much. So my name's Sally Nathan. I'm an Associate Professor at UNSW Sydney in the School of Population Health. I'd like to thank Rachel and Oliver for having us and setting up a range of meetings, including today, which is really great to have an opportunity to share with you. I'm also joined by my colleague, Sophia, who's also in the Faculty of Medicine and Health, but in Health Sciences. And we have Dan and Sam will be presenting from Way UK, which is in Swindon, which is a youth-focused charity, and Sam will share more. So we've come here and it's a great opportunity for us to talk about where are there some crossover and opportunities for us to collaborate with colleagues in the UK, where we're all working on similar things around youth, positive youth development and using sport as a vehicle. Are you going to click on for me or do you want just on? Which one do I use, the right? Here we go. So what we plan to cover today, and we hope we leave enough time for questions, but we also know with those of you here in the room, we'll have lunch with you afterwards, and we've already clocked the focaccia, which we've been told is very good. We want to talk a bit about what is sport for social change. Some of you may know a lot about it, some may not. Where Sophia and I collaborate is with an organisation in Australia called Creating Chances. So we'll share a bit about who they are. Then we're going to talk through some of the work Sophia and I have done for really maybe myself over a decade, Sophia probably the last 5 years, looking at the impact of these programs on the young people that we work with, how we've tried to involve young people, particularly in how do we define what success looks like. So the co-design we've started trying to do, and then handing over to Sam, who'll talk about Way UK and Way Sports, where they really have co-production, co-design at the absolute, centre of everything they do. So obviously there's also lots of opportunities for Creating Chances in Australia to learn from Way UK and vice versa. And then to really finish up by talking about what are some of the challenges we're facing in delivery and funding and sustainability of these sorts of programs, and how do we evaluate in a real world setting? It's really tricky. And then lastly, what are the opportunities maybe for collaboration for those in the room and those online? So sport for social change, it's something that for me, I got involved in, as I said, about 10 years ago with Creating Chances. I'm actually also on the board of the organisation, which is a social enterprise. And I've been really excited by what I've seen in what these programs can do. So it's about using sport for social change to tackle complex social and developmental and other issues in communities, focusing on at risk, although I don't like positioning the risk in the person. Often it's a lack of opportunity and system failure that leads to young people being in the positions they find themselves in. In Australia, young people, Aboriginal and Torres Strait Islander young people who've arrived from refugee backgrounds, so culturally and linguistically diverse. So they're some of the young people that we work with. And they can be at risk of social exclusion, poorer outcomes in education, employment and health. So Creating Chances, it's a not-for-profit and it works as a social enterprise. So we're listed on the Australian Stock Exchange. We have various requirements, not as an actual company, but we're covered by the same kind of security and governance rules. It's been operating for over 20 years, not always as Creating Chances. I think that's since 2014, Asma said. So, yeah, about 2014. So it's UNSW, a university that started a program called Football United with a colleague of mine, Anne Bundi-Barust, who is still involved, and she's been a major pioneer in Australia in sport for social change, and Rugby Youth Foundation that came together and became Creating Chances. So they deliver youth-focused programs leveraging sports. So sport's the hook, and it's an intentionally designed sport program. It's not just physical activity. It's intentionally designed to engage young people, building life skills and giving them opportunity to build capacity and opportunity. So as I was saying, as you know, the literature more broadly talks about, we are really reaching very diverse young people in many lower socioeconomic contexts in Australia. And the programs are very empirically informed by good pedagogy and theory and practice, and we try to evaluate them as robustly as we can. So they've got a youth development pathway. So in 2025, Creating Chances reached over 10,000 school students in New South Wales, which is the most populous state in Australia, and we're starting to see Victoria, which is the next state, starting to pick up the programs as well. So 95 high schools and 50 primary schools. So it starts with a springboard program in years 5 to 6, trying to build resilient, positive learners, teaching about coping, self-awareness, positive relationships. Then they've got in the transition to high school, the Champions program, which is probably the biggest program, where they learn to, again, more self-awareness, be responsible, work in teams. Coaches, where they're usually in about years 8 to 10, and they go back and actually have a role in coaching and supporting the springboard kids. And then Game Changer, which is kind of a social action program, and Future Pathways, which is preparing young people before they leave school for opportunities beyond school. So you can find out a lot more. There's a lot on the website of Creating Chances. So just to give you an idea, this is New South Wales. Sophia and I live in Sydney, which is around here. So they're just some of the regions. So increasingly, Creating Chances is working in quite regional and remote areas, and we do have a high number of Aboriginal young people, which creates lots of opportunities but challenges. And you can see that Western Sydney and Southwest Sydney Central Coast, there's 70 schools alone just in that area. And so the program's expanding quite a lot, and it's funded in a large part by our state government's Department of Education. So just to give you an idea, we need, 37% almost speak a language other than English at home. So we're getting, huge diversity of different language groups. About 11% have been or have had parents who've been refugees, and 27% were born outside of Australia. Some of our programs have very few Aboriginal young people, but in some places they're about 80% of the kids in the program. So as I said, we've been evaluating for a while, and very much a partnership approach. I came from the non-government sector before I was not-for-profit, before academia, so I've got a real commitment to partnering and working with not-for-profits to do research. So we've been doing it for about 11 years, but really Sophia and I sort of sat down at one point and said, look, we sort of inherited some approaches to measuring from Anne and from others, very much driven by us as researchers. What do we think we should be measuring? So one of the things we have been doing is we've been trying to engage more with young people and the facilitators who are younger and have usually come through the program and become coaches and facilitators of the programs to think about what should we measure. So we're going to share a little bit of that as well. So do you want me to hand to you? When do you want to step in?
Whenever you want me to.
Maybe for the graphs. So Sophia's more the quant, I'm more the qualitative. So we've got, the evaluation process has changed over time. We're constantly thinking about what we're doing, and now we've got a measurement tool that young people have had some contribution to. But it's not onerous, but it's still, we're getting young people to fill out surveys, which we know they don't love to do. So they can do it on iPhones, iPads, or paper in the rural schools. There's quite a lot of questions at baseline, 36, 44 follow-up. We measure, obviously, demographics, psychosocial outcomes, program satisfaction, and we have some open text. We try to do it, so programs are 10 weeks or 20 weeks. So we try to get them to do the baseline in week 1 to 2, and then a follow-up, answering essentially the same questions at week 9 and 10, or in the 20-week program, week 19, 20. As you can imagine, follow-up is not always great, and sometimes a school does all the baseline and no follow-up, and some do all the follow-up and no baseline. So it's an ongoing challenge for us to get good quality data to feedback. So in terms of measuring impact, we got about 2,000 students completing surveys in 2025. So it's not fabulous response rate, but we look at the demographics that we get in the survey response compared to the program demographics to see whether we've got at least a representative sample. And we generally do, don't we, Sophia? It's generally okay. But we use a range. We're using a compound psychological capital scale. So we look at optimism, resilience, and self-efficacy. And we also have added in scales based on the co-design that we did 2 years ago with young people, measures of teamwork, communication, and social skills. And then we've got questions about school belonging, because one of the reasons our Department of Education wants to fund these programs is to get young people engaged at school and feeling they belong and staying at school. And then we have qualitative data. So the open-ended is really valuable. We get lots of comments from young people about what's changed for them. So we ask them what's something that might have changed for you and also what they liked best in the program. And our head facilitators also do a story of significant change. I don't know if anyone's used that method. So you identify someone in a program who's had significant change and try and document what that change looks like. So we bring those data together. So this is the scales just on a diagram. The other thing we've been chatting quite a bit about with Rachel Oliver and Sam and Dan is how do we track young people over time? So I don't know what happens here, but our students in Australia do have a unique student number, but none of them know what it is because they don't need to use it. Like university students, every time you go to the library, do anything, you've got to put your, I don't know, in Australia it's called a ZID. Yeah, ZID. It's a student ID, right? But school students don't know that ID. So we can ask them, put your student ID down, they've got no idea. So we started creating a unique ID and we've now kind of made it over a number of questions. So it's really just then creating an ID from their name, the month and year that they're born. And that was too complicated. So we trialled this, we got feedback from young people. So we've sort of unpacked it now in a series of questions. So what's your first name? Tom. Put the first letter of your first name here, T. And then we create a unique ID out of that. Because we really want to try and track younger people over a longer period of time. Some do all of the programs, some might do one or two, but also even when they leave school, it would be great if we could start to follow up over time. Okay, I'll hand over to you, Sophia.
So here's a summary from, I think this was 2025, last year's annual report. And you can see the 6 domains, the psychosocial domains that we measure. So we've got teamwork, optimism, communication, resilience, self-efficacy, and social skills. And you can see by all the upward trajectory of those lines that we see positive improvement in all of these domains across both 10 and 20-week programs. Mostly 20-week programs, but I'll get to that in a second. The biggest change that we've seen consistently from year to year is in self-efficacy. It's the one that changes fastest. It's the one that changes the most as well. The one that changes the least, and in some years we haven't seen much change at all, is optimism. But we think it's probably because optimism requires a whole bunch of other things in that person's life to happen for them to feel more optimistic about their own life. So we know from these results that the program's doing something good for these kids. This is sort of more of the same improvements in self-efficacy, social skills, and teamwork from last year between baseline and follow-up.
The thing is, it's regional schools, and so they're coming off a lower baseline.
Oh, sorry, yeah. So
I think the baseline's there. Oh no, it is.
No, baseline's in the grey.
Yeah.
Yeah. So we do see when we compare the metropolitan schools, so the schools in Sydney, Central Coast, and the Illawarra regions, compared to regional schools out in Central West New South Wales, the rural kids do a lot better as well, which is what we like to see because often they experience some pretty significant disadvantage out there. Students always report that they feel, increased reports that they feel like they belong to the school, that they feel a belonging to the Creating Chances programs that they participate in. And generally, they're pretty happy with the program. We have really high recommendation rates. You can see here 84% recommend the program to their friends, and they would want to participate in another Creating Chances programs. And we know, and I'll show you some data later, that the longer they stay in the program, the better the results are. So this is good news. So I want to talk about a study that I've done, and we're in the process of trying to get it published at the moment. So this would try to think about, is it the dosage that is more important or the duration? There's probably a better word for it, but my PhD is in epidemiology. So in my brain, it's dosage and duration. So this is our current problem in Creating Chances, which is that attendance is not great in the programs. So they're weekly programs in the schools. For the students who attend the 20-week program, only about 41% of them report, so it's a self-report, report that they attended all or more than half of the sessions. In comparison, for the students who only do the 10-week program, only 20% report that they do all or more than half of the sessions. So we would like to increase this, but we also need to think about, well, how do we expend these resources? Which leads us to the research question, which is that, is partial attendance in a 20-week program producing better, same, or worse results compared to full attendance in a 10-week program? So as an example, if a student attends 50% of a 10-week program, they're attending 10 sessions. That's 10 doses. Excuse me. But 100% attendance in a 10-week program is also 10 doses. So is that going to produce the same or different changes in the psychosocial domains? So is program dosage or is program duration more important in this case? And what we did was we compared the students who did, so when we say the 20-week program, it's actually 2 programs that are done back to back. So they do champions directly followed by the coaches in the next school term, versus the students that only do either the champions program or the coaches as a standalone. All attendance was self-reported. We don't have numeric data for that, which is a bit of an issue, but we were never going to get students to remember how many sessions that they attend.
And program records aren't always fabulous.
Yeah, and program records aren't fantastic. The facilitators are really busy, teachers are really busy. They're not keeping great records of those things. And this is how we measured it. So everyone's got a baseline data collected within the first 1 or 2 weeks. And then at the end, ideally, we would like a 10-week, a mid-program data collection point in the 20-week program, but it's already difficult enough to get baseline follow-up. There was no way we were going to get any good amount of data at a midpoint as well. So did some maths, used, I don't know how many of you know about logistic regression models. So I use that to calculate odds ratios of having higher psychosocial outcomes at follow-up after adjusting for known confounders. So things like age and sex, whether they come from a refugee family, language spoken at home, whether they are First Nations. And what we found was that for the students that were doing the 20-week program, there is a correlation. The more sessions you attend, the better the outcomes, which is pretty straightforward and fairly logical. But in the 10-week program, we found that there is actually no relationship between the number of sessions completed versus the psychosocial outcomes. And you can see this pretty clearly in this graph. So the left-hand side graph is the 20-week program. The right-hand side graph is the 10-week. We have 3 domains along the bottom: optimism, self-efficacy, and resilience, and with odds ratios along the y-axis. So the referent value or odds ratio of 1 is students who attended all sessions. And you can see that with a 20-week program, there is a decline. The less that you attend, the less likely you are to have higher psychosocial scores. So that relationship is pretty clear. But you can see with a 10-week program, it's all over the place. Like there's clearly no relationship between the number of sessions attended versus the likelihood of them having a high psychosocial outcome. So from this data, we know that having a longer program does something. There is something beneficial about having a longer duration of program compared to attendance for only 10 weeks. Which led us to the next research question, which is that, is the lack of improvement in the 10-week program due to the shorter duration of the program, or is it because there's just less opportunity for those students to be in contact with facilitators? And this has a real practical question, because we were thinking about, well, where should Creating Chances invest their resourcing? Should they invest resourcing in trying to get everyone to attend every session in a shorter program, or should they invest in having a longer program, which might have better or different outcomes? So it is related to expenditure and programming. So for this assessment, I used a linear mixed effects model to look at whether partial completion of a 20-week program resulted in different scores, psychosocial scores, compared to a full completion of a 10-week program. don't worry about all the numbers. This is quite a lot to get through. But basically, what I want you to see is that, so this is optimism, resilience, and self-efficacy. There's 3 domains, and 10 all is basically everyone who attended all sessions in a 10-week program. And I compared it to people who did all sessions in a 20-week program, more than half the sessions in a 20-week program, less than half the sessions, and only a few sessions in a 20-week program. And as you can see, if you look at something like optimism, for the students, you would logically expect that if you do all 10 sessions in a 10-week program, that's 10 doses, compared to if they did only a few sessions. So we're talking 2, 3, 4 sessions in a 20-week program. Logically, you would think, well, surely if you do 10 sessions, you're going to get more benefit than a handful. But you can see there's actually no relationship here. Similarly, you see this in resilience and self-efficacy. Even if you do all 10 sessions here, compared to if you did less than half of the 20-week program, you're still not going to get, we didn't see any statistically significant changes. For optimism and resilience, those who completed all sessions in a 20-week program had higher scores compared to those who completed all sessions in a 10-week program. And for resilience and self-efficacy, higher scores are only seen when comparing full attendance in a 10-week program versus only a few sessions in a 20 program, which is all really just to say this is the final upshot, which is that longer programs enable sustained relationship building appears to be more effective in improving outcomes compared to shorter, more intensive formats. So these results tell us that the duration of the program is actually incredibly important. And our hypothesis is that you just need time and space to build trust between the student and the facilitator. You can't rush that process. So having a shorter, more intensive program it just doesn't give you the time and the space to do that for the student. So from our perspective, it is probably better from a resourcing perspective to invest in those extended delivery programs. And I know from reading some of the literature that we do see this sort of replicated in a couple of other studies around the world. Granted, those studies I think had much longer programs of like
3 months. And
yeah, well, ours is 20 weeks, it's 5 months, but there's programs that's like 9 months in duration. But at least in this particular analysis, 10 weeks doesn't really seem to have the effect that we would like to see. So, and yeah, investment in that longer period of time, maybe not so intensive, but you need the time to build those relationships.
yeah, I think the other thing too is just knowing that in terms of, young people that we're talking about, it'd be the same with kids here. Like they've got a lot of other demands on their time. They're not attending the program because they don't want to attend. They might be caring for a younger sibling at home. If they're newly arrived, they might be helping their parents to navigate the health system and be taking a translation role. There's lots of reasons why the kids aren't turning up. So the longer time period gives them more opportunity, but it comes down to, and I'm sure Sam will speak to this, the trusting relationship with an adult. And it takes time to build that. So that's something that's really critical in these programs. So we stepped into co-design. We really did feel that some of the qualitative data that we were getting in those open-ended questions from young people filling out surveys suggested there was something else happening that we weren't measuring. So we'd made decisions about what we were measuring based on program logic, but not based on what young people themselves thought was happening. So we decided to say, well, is what we're doing fit for purpose? So we had a bit of fun and did some workshops. So, co-design's become flavour of the month in Australia. I'm sure it's the same here. Everyone says they're doing co-design. I don't even know whether we'd say we didn't involve them from the very beginning. We set up the design of what we were going to do. It's very hard. We're working with school children, young people. They're, the ones who we ended up involving are in the final 2 years of school. They're doing their leaving. Like they just, the time commitment getting them even to come to the workshops, we really had to work hard to get the right people in the room. But really, you should be involving them in defining the problem as well as contributing to the solution. So in our situation, we kind of had a bit of problem definition, but we more got them involved in what do we do to better measure outcomes. So we did workshops in October, November 2023. We had 2 major workshops and working in between. And then we had to try and balance. There's a lot of different stakeholders, like, the Department of Education wants certain things measured, creating chances as an organisation. So we also did some workshops with management and some of the big funders, but we then got representatives of the young people who came here to be part of a final phase where their views were at the centre, because we didn't want something happening over here and then management just saying, oh, well, this is what we want. So we had a really careful process to make sure that these views were adequately represented in this final phase and in fact drove in the end the decision making. So the instrument now pretty much represents what this group thought we should be doing. Then we piloted it, and at the moment we've been deploying it and we're getting really good data about things that we weren't measuring before. This is just some of the mess. We had a bit of fun. We sort of tried to go a bit with the soccer, what we call in Australia soccer or football, red cards, yellow cards, green cards. So they had dots. So if they really didn't like some sort of question or a way, they give it a red dot. So we had ways of trying to balance the power in the room, because we had facilitators who were young, but they were kind of more senior to the school-based trainees who were still at school. So we used lots of visual and other ways so that they still got voice, because we actually looked at, I don't think I've got it in here. We actually looked at how long people talked so we recorded all the sessions with permission. And in fact, the very young people, the school-based trainee participants spoke a lot less than the facilitators or us. So obviously there's something going on there around power. So we obviously tried lots of different, they had to vote for things, but they all got like 10 dots, they had to go and vote. The voting was behind a whiteboard so that they couldn't see what each other was voting for. So trying to really kind of democratise the process. So we think we did quite well. We did do some feedback sheets at the end and talk to the participants about it. And generally the feedback was that they really felt it's valuable to talk about their experiences, hear other people's, that they felt that, their experience was being valued by us, an eye-opener about how much work's put into developing the surveys that we do. So yeah, generally the feedback was that it was positive. But I guess for me, one of the things that, one of the reasons to have Way UK and to work more with Sam and his team is that creating chances is just at the beginning of bringing young people into the decision making. And I think we've got a long way to go as an organisation to really centre young people's perspectives and give them more control over what the organisation does. And it's a difficult thing to do because we're already creating chances has existed for a long time. Whereas when you hear from Sam, their organisation started from the very beginning, centering youth perspectives. So I'm going to hand over to Sam in a minute, but I think one of the reasons we wanted to come here was obviously to connect with Rachel and Oliver and look at the academic side of how can we actually do some research that will contribute to this field here and in Australia, but also to look at different ways of working as organisations that are not-for-profit, delivering programs for youth on the ground. So without further ado, pass over to Sam.
Hey, my name's Sam. I'm the CEO of Way UK, and we're based in Swindon, although we started to have a bit more of a regional reach in the southwest. And my background is leading projects for children and young people, partnering with police, health, local authority and schools. We've done a lot of hospital-based stuff, schools-based stuff, community-based stuff, and setting up social enterprises. Most of that in Reading and the Thames Valley. And 3.5 years ago, Way UK didn't exist, but it started with a question. And the question was, what if a whole organisation was co-designed and co-ran by young people? Then the demographic that we exist for actually have set this up and are running it and are on the board. And throughout the whole structure and culture of the charity, we're doing it alongside young people, not to young people. And I think it would jar with us, and quite rightly so, if there was a charity that existed for another demographic, but that demographic weren't involved in driving that change and involved in the decision-making process. So we thought, what would it look like if we do it with young people? So that's exactly what we did. We gathered local young people in Swindon, most of whom from more marginalised backgrounds and face disadvantage. And we said, what do you think the needs are in Swindon? And we said, what if you had £100,000? What would you do with that to meet that need? And then we asked the question, what if you did it? And at the time, it sounds great now, like 3.5 years later, it worked. At the time, it felt like a big risk. But then we partnered with Great Western Hospital, Swindon Borough Council, OPCC, to find funding to co-design our first set of projects, and off we went from there. And one of the projects is Way Sports, but I'll go into a bit of Way UK first. So where UK, they can see partnering with young people, the public sector and wider community to produce high impact and sustainable projects. So one of the key things that young people said is, and we see it all the time, is it's just intervention after intervention after intervention. Well, young people are after relationship and community and long-term positive impact, not a one-off project. As valuable as that can be, as long as it's embedded in something that's a wider pathway, which we'll go into. Here's that kind of, this is the change that we want to see. So changing narratives, and I think particularly in overlooked communities like Swindon, in most places like Manchester, if you meet a Mancunian, they rave about Manchester and they'll have a bee on their car or whatever. But in Swindon, the Swindon culture is you trash talk Swindon. Part of being a Swindonian is Swindon is rubbish. If you want to change that narrative, what does it look like for young people to think that they have something to offer, they got something to bring? And also narratives of young people, changing systems. So we work really closely, particularly with public health, Swindon Borough Council, with the NHS ICB and with the OPCC, to really challenge and shape those systems and making sure that young people are involved in that. And we've led on 5 commissioned reports. Young people led the research, young people led the co-design of how those reports were presented, and that's led to a whole range of opportunities like co-hosting the Health Summit. And being the change, I think one thing that's really key is often there are youth organising initiatives out there, but often they focus a lot on this actually, and focus on these 2 things, which is really positive. But what does it look like for young people to feel like, actually, I can be part of the solution, and working alongside subject experts and the wider community to make that happen? One really great example is we led on co-production of a £4 million youth centre renovation, which we're now based at in Park North, which is in the top 10% areas of deprivation in England, based in Swindon, which we're now based on. And you can see there's some of the young leaders who there with hard hats on helping drive that. So there are young leaders who are in the core group, and then they work with a wider group in the community to really say, what is it that you want? We're now based on that. And I'll touch on the hospital stuff in a bit. Here's our young person-led commitment. So not only we start by young people, but ensuring that actually, if you want to see, this is my personal belief, and it's been part of the success of Way, is if you want to really do co-design and co-production really well, it's got to be reflected in governance. Otherwise, it's always a them and us. So we make sure that 50% of our board are under. There might be some spelling mistakes in this, so apologies for that. Then we have young leaders to meet quarterly to look at design and gaps and opportunities and what's next and challenging the way that we're doing things. We have change makers, and they're the ones who are leading on the reports and the commissions and the co-hosting health summits and things. And then active participants that actually any young person we're working with feels that they have ownership over their own journey within Way, and feel that they can be equipped and empowered to kind of advocate for themselves what that looks like. So, and so we have different work streams, all co-designed and identified by young people. This is what they wanted to see. So you got hospital beacons where we're in there's high repeat attendance of self-harm, in particular self-poisoning. So it's like young people like, we want to change this. Long-term mentoring, waste studios, which is particularly like just so cool. We're having to set up a record label because so many young people from from communities that face disadvantage, they're so good that we'll have to set up a record label that they can pursue as a career. Waste thoughts we'll get into, and then way change makers. This is then what's really, really crucial, is that it's embedded in a pathway for good co-production and social change. You've got to create a journey and got to create a whole culture so that the young people that you're now supporting at that moment of crisis in the hospital are the ones who are leading and driving change in 2, 3, 4, 5 years. And so we want to make sure that we have a structure and a pathway that enables that to happen, which was in itself co-designed by young people. So reachable moments, that might be the hospital, that might be the police referring, that might be in school. Journeying, making sure that there's trust. That's the one thing that young people really highlighted is that long-term trusted adults in their life. That it's not just a 12-week session, but they've got somebody there long-term. So we've helped provide that through our projects and pathway. Belonging, being part of community, and the community asset in deprivation and in the youth centre is a great way of doing that. And then on belonging, realising actually I've got something to bring here, I can shape change, and they might co-lead some of the sessions. And then actually driving change in their community or through careers, and ensuring that they're empowered to and supported into different industries and leading in that. And so that's the pathway that we seek to work on. So the co-production model is oversimplified, but this is simply what we're doing. We're going, what's the need? let's make sure we have the right people around the table. And often, a lot of the time, it's just this pink circle that's involved in the decision making, maybe a little bit of consultation with young people. But what we've said is that young people need to be involved. But you don't want to just create a blank canvas and say, off you go. You want to equip young people to do it really well and train them throughout the process and make sure you have the subject experts who are in the room to ensure that it's done really well. And so make sure you have the subject experts and community assets in place. There's different, I won't go too much into this, but different layers of co-production. So you've got the kind of more strategic work, then you've got the project design, and then you've got the participant co-production. And it's crucial. Often one of those is missing, or two of those are missing when we think about co-production, but we want to make sure that every layer of our co-design is involving young people, and then doing it as an ongoing cycle. And what we found is if you do it as an ongoing cycle, at first, we found, especially with certain programs, it's okay if some of the projects have had limited input from young people. That's where we started. That's where you've got. But as time goes by, they've got more and more ownership to they're the ones actually leading it, and that's okay. You've got to start somewhere and almost like start as a weaker version and strengthens as we learn. And that's particularly crucial as well because young people's needs are ever changing. There's a transitory population. You've got to keep asking young people, got to keep involved in the conversation, creating opportunities for leadership. Here's one example of how we did it with the hospital, which has had really massive impact, ensuring that you got the experts in from youth justice, health experts, and experts in community design and development, young leaders, and then public sector. And that's had a huge impact. So we've reached 343 young people in the past 3 years. And of those who have come into the hospital, who are repeat attenders, 62% are repeat attenders. So this is all for mental health crisis or serious violence and self-harm. Of those who are repeat attenders, 75% haven't come back into the hospital, which is remarkable in that impact. And one of the main reasons for that is that they co-designed it because they identified we don't need more medication or counselling sessions. We need community, we need mentoring, we need somewhere to go. We're lonely. That's an oversimplification, but that's what young people are saying, and that's why it's had the impact. It's not a nice to have, it has real impact. So how do we do that with sport? Well, early on, our subject experts that we worked with were creating chances using that evidence-based model. How is it working for you guys as well as others, and bringing young people into that conversation to then co-design and do it through sports. So this is what Way Sports is. We use sports as the tool for that social change, making sure that young people are co-designing everything on the way. And they're our kind of main aims that we use sports to do that. These are the programs that young people then identified and helped us co-produce. So alternative provision in school, where we're reaching young people at risk of exclusion, and then they come into the new youth centre, and we've asked them, well, what is it that you want to work on, and developing sports-based programs there, using sports-based mentoring and that long-term support for positive diversion or helping them into employment. Then World Games, which came from tried and tested, but actually, how do you then take something that is working elsewhere, but co-design it with young people to tailor it to the context that you're in? Inclusive football, group training sessions, and then captains and coaches, which is a great opportunity for training young leaders. And this is how you can see how the pathway works. One of those programs alone is positive, but when we intentionally work with young people to ensure that we're reaching them from moments of crisis and then support them all the way to driving lasting change, that's when we really start to see community transformation and positive change in the lives of young people, and then feeling that they've got change to own. There's a brief overview of a bit of the impact that we're having. Way actually is in the stage where we've had an extended period of co-design with Way Sports. We're now then looking to do some really intensive and robust evaluation and capturing those models that then we can replicate, and starting to explore replication into Milton Keynes. What's next? There's some really key things that we've been working with young people to go, what are we going to do going forward to really drive lasting change? Growing that pathway, making sure that this is actually just business as usual. How do we do that? Ensuring that there's accredited qualifications for young people to access, and then helping them into employment. And then we thought, well, actually, what if there aren't jobs available? Could we create jobs for them and setting up a young person-led gym? What does it look? Start with another what if question. What if young people co-ran a gym that generated income through customers, but also through services and support and AP? Like what? That's another what if question that we ask with young people. We like asking what if. Having a football development centre. What if there was a football development centre that was the coaches were young people that we trained, And they were then training the younger group, and then that younger group were training a younger group, and that younger group. Does that make sense? And then what if actually we had some of the programs that we could capture in such a way that you can launch nationally and empower other communities to do it whilst tailoring to that context? I'm going to hand back over. That's a little bit of a case study into where you came from.
I think one thing that I don't think we've talked enough about though, Sam, is just the intentional design. I think one of the things that Way UK does in Creating Chances is that the way that the sports programs, they're not just playing sport, they're using a concept of fair play.
Yes.
You might be able to talk more to that than me, where they get certain points for the way that they're playing as opposed to winning. So that intentional design is really critical, because sport in and of itself isn't some panacea. It's not just going to deliver by getting kids out on the field playing. It's that intentional design to build communication, teamwork, fair play, all of those concepts.
Yeah, transform culture.
Yeah. So where are we at now? So we're having lots of discussions while we're here, and we're really keen. We've got our contact details on the slides for people to reach out that might be working in similar areas or want to collaborate. We really want to look at addressing some of the challenges and building on the work that we've been doing in 2 different countries. So we know that length of program, location, Way UK is very much based in community, whereas in Australia, the model that works for us is going into schools, because that's not really accessible and able to be done here. But I'm quite interested in how can we do more in local community as well as schools to kind of, I guess, ripple out the impacts we're having with young people into communities, and also take a bit of that idea of how do we actually leverage assets that already exist in community to address broader problems and issues. So we've got very different delivery models between the UK and us, and how can we compare or work together on that or learn from each other? How do we get more sustainable funding? In Australia, we've got very good commitment from our education department, but really making sure that this isn't just another great program and in 5 years the funding's gone. How do we measure longer term impact? So we all know that evidence matters, and so how do we actually track young people over time so that we can see whether the kids that started in Springboard in our schools in Australia have ended up in careers and meaningful work and lives, 5-10 years down the track. And then things like measuring concepts like social cohesion. So we tried in a previous piece of work to measure, was there change in community? We couldn't really show it. And some of that was probably the measurement tools, and some of that was probably the way we went about it. So there's still a lot of work, both in terms of program delivery and learning from each other, but also in terms of trying to build a better evidence base for this work. So I guess some questions that we thought we'd throw out to the group, we've got about 15 minutes, is, I'm really interested in how we can use more co-design, co-production approaches with young people and communities to improve the kinds of programs that we run and how we evaluate them. And you might have experiences from your own work that's aligned. And also, how could we work across the 2 places, UK and Australia, to build an evidence base? Because there's a lot of similarity in what we want to do. Like, we've all got very similar aspirations and agendas, but very different contexts. But I think that's interesting. And how could we actually do a program of research where we can learn from both, that then could also inform other countries that maybe are using sport? So we've got a collaborator in the US as well. And again, that's a whole another different school-based system and context to work in. So I'll just quickly, I'll go back to it, but there are contact details, so really keen, and we'll share these slides as well. And just there's some of the references, but we've also done a little bit of publication. As we know, publish or perish. We're trying to obviously build a little bit of a track record, because we want to try and go for some bigger grant funding. So Laura was the lead, who's a student of the co-design work, which is the chapter, Sam, that you're on. I don't know if I've got it up here. Number 2. So it says that how, but there's a whole group of us, including Sam, where we presented at a conference, and then we've written up some of the work that we've done. So, if you want to know a bit more and you don't want to reach out, you can have a read of that. But yeah, we just wanted to throw it open now to the group in the room and those online. So that we can chat more afterwards. But I would like to take this opportunity to thank again Rachel and Oliver for hosting us, and the Institute for having us today, and for all of you for coming. And we hope this, creates more connections between Loughborough and us and Way UK and Creating Chances. So thank you so much.
Thank you for listening to the podcast of Loughborough University's Institute of Advanced Studies. A quick reminder about how to stay connected. You can find us on Blue Sky, LinkedIn and Instagram, and you can also watch the presentations on YouTube. The podcast is available on all the major platforms. Please download, share, and most importantly, subscribe. See you next time.